November is Gastric Cancer Awareness Month. Gastric cancer can also be referred to as stomach cancer. Oftentimes goes unnoticed until it is in its advanced stages. Nearly over 26,000 people in the U.S. are diagnosed with this disease each year. For more insight on warning signs and ways to prevent stomach cancer, we spoke with health experts at UT Health San Antonio. November is Gastric Cancer Awareness Month, and we're spotlighting it this morning by welcoming in Dr. Matthias Franco from UT Health San Antonio. Thank you so much for being here, doctor.
Thank you. Good morning. Thank you for the invitation.
Dr. Franco, 26,000 people are diagnosed with gastric cancer each year. In summary, what is it?
First of all, I think it's important to give the concept of what is gastric cancer. It's when abnormal cells grow in the line of the stomach and start forming a tumor. Of course, this can affect how the stomach digests food. And we've seen this trend of a higher number of cancer, especially in the people below the 50s. And it's related with the change of the diet over the decades, changes of the diet of the society over the past decades, and also related with the obesity rates. So that these two risk factors could be, responsible for this increase of number of diagnosed, this large amount of cases that have been diagnosed for the past years.
Well, what are some early signs or warning signs that people should be, being on the lookout for?
Yes, early symptoms can be easily mistaken for common digestive issues, things like persistent nausea or vomiting, feeling full quickly or losing your appetite, abdominal bloating or discomfort after eating, unexplained weight loss, fatigue, sometimes black tarry stools indicate blood. So if someone experiences these symptoms for more than a couple weeks, would be important to see a doctor and possibly getting an endoscopy.
Would you say there's possibly a certain group of people that are more vulnerable to contract this kind of cancer?
Yeah, so we understand that age is also a related risk factor. So people over the 50s, they are with a higher risk of having this condition. We also know that the gender is also related with this condition in terms of men are affected almost twice as often as women. Smoking increases the risk significantly, and patients with a family history of cancer. So those are the patients that with any sort of disease, any sort of symptom, should be looking for having an appointment with that doctor, and having a procedure to rule out this condition.
If someone is at risk, what are possibly some things they can do to lower their risk?
That's a good question because fortunately, many of these risks can be reduced through our lifestyle choices. For example, maintaining a balanced diet rich in fruits and vegetables, avoiding smoking and limiting alcohol ingestion, keeping a healthy weight and exercise is also another activity that the patient should be doing. And if the patient is diagnosed with H. pylori infection, Helicobacter pylori infection, which is a bacteria that can affect the stomach, so those patients should be looking for a treatment for that.
How would you say treatment has evolved in the recent years?
So this is a really good question because the treatment has evolved tremendously. Starting with minimal approach done by endoscopy that we can avoid surgery for patients with early cancer. So we can remove the tumor by endoscopy without needing any sort of incision, without needing surgery. And we also nowadays, we have targeted therapies and immunotherapy that helps patients with advanced disease to have a longer survival and also having a better quality of life.
All right. Dr. Franco, is there anything else that you would like to add to possibly shed light on gastric cancer?
Yes, I think a final statement is for the patient to be aware about this condition. And if the patient has any symptoms that could be related with this condition, to look for appointment with a doctor and go through a procedure examination to rule out this condition. Thank you.
Thank you so much for your time.